Physical therapists say patients will suffer if MDs are allowed to refer patients for profit. Sacramento, California, February 23, 2011. Hundreds of physical therapists in California vowed today to aggressively fight a bill recently introduced that allows physicians to profit from referring patients to physical therapy services owned by doctors. AB 783, authored by Assemblymember Mary Hayashi, slipped by public notice over the holiday weekend as news broke about a massive federal bust involving 9 states and the arrest of more than 100 physicians, physical therapists, and other healthcare practitioners alleged to have engaged in the largest Medicare scam in history. The California Medical Association coincidentally named Hayashi its Legislator of the Year in 2009. Hayashi's bill would override current state law preventing physician corporations from employing physical therapists and referring patients to their own physical therapy clinics, greatly increasing their profits. The California Private Practice Group, a physical therapy group of private practitioners, calls into question the intent of the proposed legislation introduced on February 17, 2011. Hayashi, who has strong ties to the California Medical Association and chairs the committee that will hear the bill, put the bill on urgency status, meaning it will take effect immediately upon passage by the legislature. In California, the Moscone-Knox Act, as found in the California Corporations Code 13401.5 and provisions of the California Business and Professions Code, were legislatively designed to prevent the unlawful practice of a special licensed profession by those not holding the same professional license. In short, the current statutory construction prevents the CMA and their physicians from owning physical therapy practices or controlling and directing physical therapists in how they exercise their independent professional judgment, because that would be against the public policy protected by Moscone-Knox, thus putting the public at risk. In September 2010, the California Legislative Council rendered an opinion declaring employment of physical therapists by medical corporations illegal. Current law supports that opinion, and the Physical Therapy Board of California has declared its intent to discipline physical therapists employed by medical corporations. Studies by the Medicare Payment Advisory Committee and the Office of Inspector General examining physician-owned physical therapy services have found over-referrals, excessive costs, and substandard care in over 91% of the cases reviewed. Using statistics from a California workers' compensation study concluded during the early 1990s, the adverse economic impact of POPTS on California workers' compensation system can be estimated to have exceeded $8 billion over the last 2 decades. Hayashi's ties to the CMA are transparent. In addition to the award in 2009, MapLight.org lists the CMA as the top contributor to Assemblymember Hayashi during the last 2 years of available data from October 2008 to October 2010. Contributions from the CMA totaled $22,608. The next highest contributor was the California Teachers Association at $15,600. The contributions from the CMA to Hayashi are more than twice the amount given by the number 10 on the list of top 10 contributors. Physician-owned physical therapy services are bad business. They result in over-utilization. 91% of the time, physical therapy care is substandard, and it costs California over $8 billion over the last 2 decades. California cannot afford to overpay for bad care.